Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, for people who wonder what a dermatologist does, most of you know that they really care about your face, your skin. I have an expert here, Dr. Angelo Ayar. And Dr. Ayar is at the Florida Dermatology and Skin Cancer Centers, and that's down there in Tamarac. And I'm I want to welcome you to the show, Dr. Ayar.
Thank you for having me, Anita. Pleasure to be here.
Being a dermatologist is hasn't it changed over the years? It used to be strictly dermatology, where you go into the skin, but now you do so many things.
There's a lot of aspects to dermatology. We do a little bit of everything. So there's general dermatology, like a rash or acne or a spot, but there's also surgical dermatology. So if you have a spot that needs to be removed, a cyst, a cancer, dermatologists can do that. So there's surgeons as well as sort of the standard doctor. And now as the technology improves and as medicine advances, there's a lot more to offer in terms of cosmetic dermatology. And that has to do with operating lasers, doing facials, peels, injections, filler to enhance what's lost over time in our face in terms of volume, and of course wrinkles with Botox. So over time with our facial expression, we tend to get creases in our face, and there's medications now that help to reverse that. So you run the gamut. It's definitely a rigorous training that we do so we can do all these things.
You've been on a real learning curve, I can tell you that. I mean, you're not old, but when you first went into medical school, did they also get to teach you about all these other little things, or did they mainly just teach you about dermatology?
So in medical school, dermatology is not taught very much. There's at University of Michigan, there's a 2-week course in medical school for dermatology.
You're kidding.
So it's almost like nothing. It's like you get the very minimal basics. So most doctors are not really trained at all in terms of the skin and dermatology and dermatologic diseases and things. So they almost don't know hardly anything. So when they see something dermatologic, they kind of just, most of them just are not really familiar, and they just shove them off to the dermatologists. When I got to my dermatology residency training program, the first thing that happened was you have to learn this language of dermatology. There's all these funny words. So first you have to learn a new language before you can even start learning what to do. So it was pretty interesting, and it was things that I never even imagined existed. Now I'm an expert in.
And what made you want dermatology after you got out of medical school?
So I don't have any doctors in my family, so I decided to become a doctor, and I thought, in medical school, I'm going to go through my rotations and decide based on what rotation I like, that's what kind of doctor I'll be. And I thought I was going to be a cardiologist. I did a rotation, and, I loved it in the beginning, but, over time, towards the end of the rotation, it got redundant. And I saw that the cardiologists, they just sort of, they were happy, but they were kind of clocking in. They were kind of doing the same thing over and over, and they had their routine, and they were stuck to it. And I thought, in 20 years, that miuld get boring, and I didn't want to be that. So I was doing a radiology rotation. That was the other thing I thought I was going to be. And I told the radiologist, hey, I'm going to do a rotation in dermatology. It might be kind of interesting. He goes, oh, you don't want to do that. I go, well, why not? He goes, you became a doctor, right? I was like, yeah. He's like, all they see over there, acne and warts, acne and warts. You didn't go to medical school to treat acne and warts. I was like, oh, gosh, you're right. I don't want to do that. So I almost canceled my rotation and didn't even rotate in medical school. But then I ended up doing it, and it was what I saw there were things I'd never even seen or heard of before. I didn't see acne until 1 week in, and there were just things it just blew my mind. And the older doctors, they see things all the time, and they're just stumped. That they're always learning. And I was like, this will maintain my interest over my career, so I chose to do it.
It's interesting. I saw a movie, and I don't want to take too much of your time, called Wonder. Mm-hmm. I don't know if you saw that with the little boy who was very disfigured.
I think I have seen that, yes.
Yeah,
it's been a while.
And of course that was a plastic surgeon, but yet, as you're talking about all the various things that you can do with the face.
Yes.
I know I've had Botox and I've had a few things, but it is amazing, and yet I want to know how far someone should really go.
They should go, it's a subjective question. So, beauty is in the eye of the beholder. It depends on, I ask people, when they come in, they say, hey, I want something done. I give them a mirror. I say, well, what bothers you? Okay. And they say, well, this bothers me. Today I had somebody say, I have these jowls and I don't like them. They bother me, He goes, I don't want any surgery, but I want the fillers to plump my face back up because I lost some weight. I want it plumped it back up so then these jowls will go away. And they were biting their cheeks. There was so much redundancy in their skin. And so there's a fine line in terms of what you could do with like a filler and what a dermatologist can do in an office, or a plastic surgeon, whoever does, these cosmetic things. There's a fine line between what you can do in your office and what, really requires, more invasive procedures. So for this person, I said, fillers can't take you that far. They go up to a certain point. After that point, you really need to have,
plastic surgery,
a facelift. You need to have that skin removed. I can't plump it up to the point. It's going to cost so much money, and fillers don't last forever. They last maybe a couple years if you're lucky. So I told her about the numbers and about what you could expect, and
good for you. So your honesty is very important in this profession.
Always, yeah, because you don't want somebody not liking you.
No,
I don't want somebody to leave my office unhappy, especially after they're spending thousands of dollars.
Yeah.
So how far should they take it? That's up to you.
It's a personal situation.
It's a personal decision.
Yeah.
But yeah, there certainly is a line further down the line where you're seeing, faults in yourself that other people don't see. And it hasn't happened to me yet, but yeah, if it ever did, I would, tell them to maybe seek a therapist or something.
How long have you been practicing dermatology?
About 2 years. I graduated 2 years ago.
That's great. So you are on the youthful cusp here of a lot of good things. I'm very impressed.
Freshly minted.
Yeah, freshly minted, but that's good as a matter of fact. I think that's a wonderful thing.
Mm-hmm.
So just everyone, I want you to know that my guest is Dr. Angelo Ayar. AR.
Yep.
And he is located in Tamarac. And the way that you can get a hold of him and set up an appointment would be to call 954-726-2000. Now, do you have other dermatologists there with you?
Just me. So far, just
You're
me.
it, huh?
Yep. Maybe there will be a day in the future where we bring other people on, but right now there's not even a mid-level. So if you make an appointment, you get to see the doctor.
It. That is really terrific. Well, I'm very excited about everything that you're doing, because I think you said it. Some of the dermatologists have been there for a while. That they are set, they know it, but you are fresh.
Yep.
Off. You know a lot of new things, don't you?
Yes, it's probably one of the fastest growing and changing fields. Dermatology from the 70s or 80s, the books were pretty thin. Now my books stack up to like my waist. So the stuff that we had to learn is like, multiples of 10 and 100 in terms of volume of stuff we had to learn compared to what they used to have to learn. And once you're out and you're practicing and you're busy, you're working and family life and whatnot, it's hard to keep up. So it's nice that I'm up to date.
Right. And so I think that an elder person, most of them they come in and you examine them to see what they might have on their body, don't you?
In the state of Florida, skin cancer is the highest here than anywhere in the United States. And, for good reason. The sun's really hot here, and people come here to enjoy the sun. But that radiation that's coming from the sun is very damaging to your skin, that ultraviolet radiation. And that causes, skin aging, but more importantly, skin cancers. So, in the state of Florida, I recommend at least everybody to see their dermatologist once a year. When they reach adulthood. I have young adults, I have older adults. Everyone just come in, see a dermatologist once a year, look you over. If there's nothing, there's nothing. But, if there's something, the last patient I had today, she had a melanoma. And she was, middle, 50s.
And where was it?
On her forearm.
And what did it look like?
It looked very inconspicuous. It had very faint brown dots kind of in a circle. And she had freckles all over her arm, but this was like a little group. She said, another doctor looked at it, a year or so ago. They said it was nothing, and it just sits there and it hasn't changed. So I'm not worried about it.
Okay.
But, I've seen enough, and I've done, extra research in dermatology when I was in training. I just know you just see so much. It just had I had a bad taste in my mouth, and I had just a gut feeling that, this, I'd rather have this off than I would rather have it on you. And it turned out to be a melanoma. It was a thin one, and we got it all, and she'll be fine.
And what if you didn't do anything with it? What would have eventually
Melanoma
happened?
is deadly. Melanoma is a deadly progressive cancer. So if you catch melanoma early, it doesn't get deep enough into your skin to get into your blood vessels and spread throughout your body. But if you leave it there long enough, it will continue to grow and grow. And if one of those cells breaks off and gets into your bloodstream, it could spread throughout the body. And then you have stage 4 disease, and it's a deadly condition.
Even as small as it was on her little wrist.
It was, it was the size of the end of a pencil eraser.
Uh-huh.
But, we used to think, it has to be pretty large for it to be deep. But, you could have a very small spot that, can track deep. So,
and that's really an interesting story. And
yeah.
So you, and what do you have to do to get rid of it?
So, I surgically excised an area around it. So her melanoma was 0.3 millimeters, which is on the thin spectrum. And the standard of care is 1 centimeter around where the lesion is. You take 1 centimeter around it. You take out that piece, you send it to the lab, make sure it's all clear. And then, it surgically close up the defect so that, she'll have a scar there, but the skin will close up and heal well over time. And once if you have a thin melanoma, all you have to do is follow up with your dermatologist every so often to make sure you don't get another one. You don't do scans or tests or drugs. But if you have a thicker melanoma, I refer to a tertiary center that specializes in it, and you potentially have to do, chemo, scans, and radiation and all that sort of thing, depending on the depth. So if you catch it early, it's a matter of just cutting out a piece of skin and monitoring, every so often to make sure they don't get another one or it doesn't recur. If it's thicker, deeper, been there longer, more aggressive, it's a potentially deadly condition. And I don't know what last year's numbers are, but I think about 5,000 people a year or so die from melanoma. So,
and so people who are light skinned, fair skinned, they probably tend to get more cancer, don't they, than someone who's of a darker.
So what's the risk factors?
Yeah.
The risk factors are fair complexion. So the lighter your skin tone is, the less melanin you have in your skin, and the melanin blocks that radiation. So the lighter skin you have, the less melanin you have, the more radiation affects your cells. So that's one thing. Having fair, light-colored eyes, blue eyes are a risk factor. Those are genetic things. And then your family history. If I ask people, if anybody in your family have a melanoma, and there's certain just genetic predispositions in some families where they are, at a higher risk factor, even if they aren't fair complected. So those are the major things. It's fair complexions, lighter eyes, family history. Those are genetic things. You can't control those. And then the things you can control are environmental, like exposures. Tanning beds. If you use a tanning bed just once, you have like 100 times increased risk of developing a melanoma. It's the worst thing you could possibly do.
Well, that's an interesting article to write about.
Yeah. Oh, yeah. It's been written about. Yep.
Oh, I must not have read it.
Yeah.
I mean, I don't do tanning beds, but that's a very important thing.
Yep. Tanning beds the Surgeon General a couple years ago said it's worse than cigarettes. It's like more deadly and carcinogenic than cigarettes. But also laying out in our sun here. The sun in Florida is really hot. It feels like it's cooking your skin. So what you can do to prevent that is wear a good sunscreen, SPF 30 or above every day, and reapply it if you're outside.
Okay, Dr. AR, you're good. I'm so glad we had this discussion. I hope we're going to be able to talk to you more. I'd love for you to be writing articles and doing radio all the time. You're smart. Okay, I want everyone to please call 954-726. Let's see. I have this again.
2600.
Yeah, I have a different one on your. I have something different on your card.
Oh,
here.
it's okay. So it's 954-726-2000.
Yeah, that's the one.
That's the number, and we're in Tamarac by the University Hospital. We're on the campus. Our office is right there.
Thank you so much for being here.